Okay, my name is Courtney, and for the second part of this video, I'm going to be doing a sterile urine sample as well as removing the catheter from the patient. So, to get a sterile sample, I have my sterile sample cup ready. I'm going to go ahead and clamp off that tubing if there's no visible urine in the tubing. I'm going to go ahead and clamp that off about 1 to 2 inches below the port and leave that for no longer than 30 minutes. Once there is urine backed up into that tubing, I'm going to go ahead and grab my alcohol swab. And I'm going to clean that surface. Circular motion. Allowing that to dry for a minute. Then I'm going to take my syringe, my 10 cc syringe with the 25 gauge needle. I'm going to go ahead and insert that at an angle into the port. Then once I get that in there, I'm going to go ahead and draw back my urine, usually 3 to 5 mils. Once I have my urine, unclamp my tubing for my patient. Take my sterile sample cup, keeping the lid in a downward position. Insert my urine into the cup. Flip up my safety on my needle. Go ahead and screw the cap back on my sterile sample cup. Now I'm going to make sure that I time, date, and put the patient's name on this. It needs to get to the lab within 15 minutes to be viable. So I'm going to set that aside. Now I also have an order to remove the catheter from the patient. So first off, what I'm going to do is take some tissue, put it underneath my patient just in case there is any urine dribble. Then I am going to see if the charting has how many cc's the balloon has in it so that I know how much I need to draw out. If not, I'll just take my 10 cc syringe. Don't need to use an alcohol swab since this is going to be coming out. I'm going to prime my syringe. Once I get that in there, once the syringe is primed so the fluid will start coming back, I'm going to go ahead and hold on to the catheter so that it doesn't slip out. Once all the fluid is out, out of the balloon, I'm going to pinch the catheter and I'm going to slowly pull the catheter out with a downward motion so that the catheter is kept upward to make sure there is no urine leakage. I'm going to go ahead and visualize, make sure that the end of my catheter, everything is intact and how it's supposed to be. Once I get that out, I'm going to take my glove off, cover up my patient so they have their privacy, put the side rails up, make sure they have the call light. Then I'm going to go find a biohazard bin to put the used catheter bag in and make sure I do my documentation.